I have done my master's in hospital management from University of Leeds long back, and what I've learned from there is keep the things simple and straight. So currently the pace of healthcare expansion is booming in Nepal. If you see in last few years, there have been a lot of hospitals which have come up, and every day new technology is being introduced in healthcare. So there is a lot of scope for healthcare management students which is going in coming time. So what my suggestion to all the students of hospital management is that they need to focus upon certain skill sets. So first one is the communication. So they need to understand that communication is the key for success in management. Communication with their partners in healthcare, communication with the patients, and communication with the external stakeholders. Then what they need to focus upon is working upon different management frameworks. They need to learn new frameworks which are evolving over the period of time, because things which are working now are going to obsolete in coming times, because the space have increased with the introduction of AI. The space have drastically increased. What working today may or may not work tomorrow. So they need to be updated on AI. They need to learn how to drive AI systems, because ultimately that's going to be coming future. And most important is keeping the center or keeping the patient in center in whatever they are doing. So all their decisions should be patient centric, because that's ultimately what's going to take them forward. System and processes is what governs a hospital. And if a person sitting at leadership position or at hospital manager, if they are not able to understand these processes and the system, then it becomes problematic. Problematic in a way that there may be delays in the processes, patient may have to wait for long, then there may be a loss of revenue in the hospitals because of the decision which has been taken. So ultimately what a leader need to focus upon is a good decision making which involves the people, because the more people you involve, the better it is. And a symptom or a sign of a weak leadership is that they will not involve people. So my suggestion is that all the leaders in healthcare should involve more and more people in the decision making, because it's called critical evaluation, where you involve multiple people in the decision making. I'll give you a simple example. Like 5 or 6 blind men were going, and suddenly they collided with one elephant. They were not knowing what it is. So now when they start evaluating it, one went to the trunk, one went to the foot, one went to the tail, and they start describing that this is wall, this is a pipe, and this is a brush. So ultimately, when all of them combined their observation together, then they could make out it's an elephant. Likewise, in management also, one may or may not have a clear view of the things. So when you involve people, you will get different dimension of that particular issue to understand it better. And once you understand from different perspective, then it becomes easy for decision making. And in my experience, these decisions are effective and they makes a big impact. As per Institute of Medicine report, 1 in every 10 patient get some form of unintentional harm during their stay in hospital. Unintentional because no doctor or nurse want to harm their patient. It's the other extrinsic factor which leads them to cause that harm to the patient. At Nepal Mediciti, we have implemented all the system and processes which prevent the harm to the patients, right? So I'll cover it in the next section, where coming section. But in this question, if I tell you that people, the hospital management students should focus upon communication, patient safety, healthcare quality, because that is going to teach you the overall 360-degree about healthcare. At Nepal Mediciti, all our decisions are based upon patients. We keep the patient in center of whatever we do. Starting from our housekeeping to the top management, it is made very clear that patient outcome should be main focus, patient experience should be main focus, and each and every patient who is coming to Nepal Mediciti should go out happily and healthy. So in that one, what initiative we have taken is, we are taking regular training for our staff members. We are taking regular audits. So we are the first hospital in Nepal which is having a dedicated quality and patient safety department, the role of which is to audit different processes and system in the organization to evaluate people whether they are complying to system and processes or not. We evaluate it on a monthly, weekly basis, and then accordingly we take corrective and preventive action. So there are a lot of changes which have been introduced since I have taken over. So first and foremost is enhancement of communication at each and every level in the organization. Then setting up accountability and responsibility at different level. We had also invested a lot into new technology, and currently we are working upon bringing in robotic system as well as new HIMS, which is AI integrated, so which is going to help the patients, even the staff, a lot. If you ask me the current challenges, things are a bit challenging in Nepal as compared to if you ask the neighboring countries like India. So I have worked with multiple hospitals in India, now working in Nepal, so I can give you a clear contrast between the two. Things which are easily available in Indian hospitals, we have certain times it's become challenging to get those things here in Nepal. Then the availability of different new technology. So many times things have introduced faster there, but it takes time for that new technology to come to Nepal. Things are also costly because everything is, most of the things are imported, so because of which the cost rises. So these are the major challenges currently the hospitals are facing. Quality and patient safety is base, and this is, we are not saying, this is, we have been accredited by a third agency which is called NABH, which certified us that we are providing quality and safe treatment to all our patients. I'll give you certain examples in terms how the system and process is working at Nepal Mediciti to keep the patient safe. So first and foremost risk is the infection. So we do have a dedicated infection control department which monitors the infection rate in the hospital proactively, and then make sure that all the protocols for infection control are being adhered to by the staff at any given time during the stay of the patient. Secondly, safe surgery. So we do have safe surgical checklist. Like in aeroplane, the pilots, they do have safe checklist before they fly the aeroplane. So likewise, we have developed those checklists for our surgeons. So before surgery, so the surgeons and the whole team will go through that checklist, and then make sure that human errors are minimized. Next comes the medication safety. So in medication safety, if we see globally, majority of the harms are being caused by look-alike medicines which look similar to each other or the name of which are similar to each other. So we have color-coded them, we have kept them separately. Likewise, there are high-risk medicines. So those medicines which given by wrong dose or wrong route can harm patients substantially. So we have identified those medicines, stored them separately, labeled them in red, and we had made a protocol that these medicines needs to be given by 2 nursing staff only. As our vision says, for a healthy and prosperous nation. And our chairman, Dr. Upendra Mehto, have instructed us that no patient should go out from Mediciti without treatment. So in that line, what we are doing certain times, if patient is not able to afford, we are going to take care of that patient. Secondly, what we are doing is we are conducting lot of rural health checkup camps. Those are free of cost. We are not charging them. And to make treatment affordable to masses, we are working upon new policies which will be very beneficial for public, general public. So we are among the first hospital in Nepal who have introduced the technology of telemedicine. So since day one, we do have in our system the telemedicine facility, and we have been doing it regularly. And NRNs and Nepalis settled abroad, they are taking this facility a lot. We are regularly getting telemedicine consultation for the people who are settled abroad, specifically Nepali, those who wants a second opinion. And secondly, in terms of technology, we are bringing in new advanced technology which are available for healthcare to make the treatment more efficient. And likewise, we are in process of getting a robot. So that will be introducing shortly. So shortly you will be seeing the services for robotic surgery at Nepal Mediciti. Nepal is having a lot of huge potential in terms of becoming a big medical hub. Because if you see, thousands of doctors and nurses from Nepal are working abroad in different countries. And the level of care which Nepali nurse provide, I think no one can compete that. Secondly, the environment here is healing. I think it's God's own country. So because of which the environment is soothing, there is less pollution, and the healing environment helps the patient to recover fast. So what lacking now is the technology. So if we are able to introduce new technology, and if we are able to bring our people back from abroad, and if they start providing the healthcare to the people here in Nepal, so what I believe that no one can stop Nepal to become a big medical hub. In my opinion, Nepal is having a lot of huge potential to become a big medical hub, and that is possible only with collaborative effort. My request to all the fellow hospital managers, CEOs, that we should work together to make it a big hub, and it's not feasible and possible by one hospital only. Once it's going to be a hub, then it needs to be multiple hospitals collaborating together to provide the best possible care in the world to patients, which is going to attract more and more number of people from outside. Currently, if we see, the people are from Nepal, they are traveling mostly to India to get the treatment done, and different other countries. So we should provide that level of care. We should provide that level of technology. We should provide that level of empathy so that people don't have to travel abroad. Once we are able to retain our people here in Nepal, The second thing is to get the people from abroad to come here and get the treatment done. Anyhow, that scenario we have started, but there is a long way to go. So in that context, my suggestion to all fellow hospital managers and CEOs is that let us sit, let us collaborate, let us work together for efficient, safe and quality healthcare in Nepal. And that's very much possible, feasible, and we can achieve it together.